Oh,
Alright, today class we are going to be learning about contraceptives. Do you guys know anything about contraceptives before we start here?
no.
Alright, okay, we'll start with this. What are contraceptives? Contraceptives are also known as birth control, and birth control is used to prevent pregnancy. Contraceptives or birth control methods, consist of medications, procedures, devices, and other behaviors. Availability of contraceptives can be over the counter stores. There's a very wide variety of where you can get them. Some methods, such as condoms, are widely available at drugstores, Walmart, gas stations, other places such as that, while other ones are prescription pills, are required to be seeing a doctor or something like that. We'll start off with the types of contraceptives. IUD is a little T-shaped piece of plastic that gets put into the uterus to mess with the way sperm can move inside and prevents it from fertilizing the eggs. The next one would be implants, which is a teeny tiny rod that is inserted under the skin of your upper arm that is implanted to release hormones that keep your ovaries from releasing eggs and thickens the cervical mucus. This helps block sperm from getting to the eggs in the first place, and it prevents pregnancy. And this will last up to 4 years. And the next one is the shot. As it sounds, it's getting a shot. This is, once you get the shot, your birth control is covered for the next 3 full months. Nothing else you have to do until after those 3 months are done. You'd have to get another shot. The next one will be the ring. The ring is a small bendable ring that is inserted into your vagina. The patch is another good use of birth control. The patch is a patch that is very simple and affordable birth control method that you wear on your skin. Places that it's usually put is on your belly, upper arm, butt, or back. You put on a patch every week for 3 weeks, and it releases hormones to prevent pregnancy. After your 3-week cycle, you have 1 week of not wearing a patch at all, and then the cycle repeats. The pill is the most common one, and there's many types of it. Most work by releasing hormones that keep your ovaries from releasing eggs. The hormones are also thicken your cervical mucus, which helps to block sperm from getting to the egg in the first place. A diaphragm is a shallow dome-shaped cup made of silicone. You can insert the diaphragm into your vagina. Then it covers up the cervix and keeps sperm out of your uterus. One super important thing to remember when this is, for a diaphragm to work effectively, you need to use it with spermicide. And we'll get to spermicide in a little bit later. We'll go to the next slide. Another very common one is the condom. The condom is a thin covering worn on the penis during sex to prevent pregnancy. Then we got the female version of this, which is the internal condom, and that is a condom. It's kind of like a pouch you insert into your vagina. And then the cervical cap is a silicone cup you insert in your vagina to cover your cervix and keep sperm out of your uterus. After that, we got the fertility awareness. This is where the woman or family will track their menstrual cycle to determine the days they can get pregnant. The tricky part is knowing what those days are, and when you'll need to pay very close attention to is your body and what patterns you're going in. The sponge is our next one. It's a round piece of white plastic foam with a little dimple on one side. It has a nylon loop that kind of looks like a shoelace material. It's small, about 2 inches across. It is inserted way up into your vagina before you have sex. The sponge works in 2 ways. It blocks your cervix to keep sperm from getting into your uterus, and it continuously releases spermicide. And now spermicide is pretty much different things. It's such as creams, foams, gels, anything like that, kind of that contains chemicals that stop sperm from moving. And then another way, our last one that we're going over is withdrawal, which is the practice of withdrawing the penis from the vagina and away from the woman's external genitals before ejaculation to prevent pregnancy. And then here's some other ones that we got. We got sterilization, which that is just making sure that you won't be able to have babies after that. Not right now. That's just being smart. If you're not ready for sex, don't do it. And that's one of the things. There's always Plan B, which can be bought at most convenience stores such as Walmart and stores like that. Sometimes it's over the counter, sometimes it's in a case, sometimes it's not. And the best way to do this is abstinence, which is not having sex at all. Here we got the most effective forms of contraceptives. As I said before, abstinence is the most effective one, and then IUD, and then implant, and then sterilization. Those are your 4 most effective forms, just as contraceptives that work best for you in preventing pregnancy. STI, which is sexual transmitted infections. The best prevention for those are condoms, internal condoms, and of course again abstinence. If you're not doing it, you're not going to have to worry about these. And now this leads us, well, first I want to give you a review. What is the most effective way of not getting someone pregnant? You?
Not having sex.
Correct. What is the most common method that women use for preventing pregnancy?
The pill.
Correct. Where can you find condoms?
Walmart or gas stations or drugstores or anywhere like that.
Alright, correct. Okay, now this leads us to our activity that we will be doing. For this activity, I will pass you out banana and a condom, and today we are going to learn how to put a condom onto the penis. For me, because I'm going to demonstrate it first on a banana, and then I'll have you guys show me that you are able to do it. So first, you want to make sure you open the condom correctly. You want to rip it on the side so that you don't rip the condom or break it out. Any way of doing that. Okay, so once you get the wrapper open, you pull the condom out. As you see, there's a little top hat right here, and you want to make sure you pinch that, and then you put it onto the tip of the banana, or in other words, the penis. Once you have it there, you will roll down the rest. You want to make sure you're pinching the top so that there is no air in the top, because that is where the sperm is caught. Now once you slide onto your banana, it should be fully on and tight on the banana, and you can look at this to be sure that you did it right. And as I can see, you both did very well on it. Good job. All right.